Hi, I'm Caroline Stocks with Poultry Health Today, and with me is Jared Oxford, who's a graduate research assistant at the University of Georgia. Jared, thanks so much for joining us. Now, we all know that necrotic enteritis is a big issue for poultry producers, especially in no antibiotic ever systems. You studied the effects of glutamine on necrotic enteritis. Why glutamine?
So I found a hole in research where humans and other animals, they've shown that glutamine is very effective in enteric challenge models and stress models. There's practically little to no research in poultry using glutamine, so I figured I'd give it a try and see how it worked. My previous experience was with coccidiosis, so I tried it out, and now necrotic enteritis.
And can you tell us a little bit about the study that you carried out and the size and what you did?
So for this study, we had 4 treatment groups. We had a unchallenged control, we had a challenge control, and then 2 glutamine supplementation groups, so one with 0.5% and one with 1% glutamine, and that was a crystalline, pure glutamine source. At 14 days, we challenged them with 5,000 oocysts of Eimeria maxima, and then on days 19, 20, and 21, we challenged them with 10 to the 8th colony-forming units of Clostridium perfringens to induce necrotic enteritis. And from there, on day 21, we evaluated necrotic enteritis lesions, intestinal permeability, glutamine serum concentrations, and an array of cytokines within the jejunum and the cecal tonsils.
So what were the parameters then that you measured in the birds?
So the biggest was intestinal permeability. It's kind of the key in necrotic enteritis. So through that, we did a FITC dextran, which is fluorescent dextran assay, where we inoculated the birds with the FITC dextran and then 2 hours later collected blood. And we saw that glutamine at 0.5% reduced intestinal permeability in birds challenged with necrotic enteritis from that. We also looked at serum glutamine concentrations. So during times of enteric stress like necrotic enteritis, the requirement of glutamine in the intestines is very high, and so it pulls glutamine from other sources like the muscle to meet those requirements. And we saw during challenge, serum glutamine concentrations significantly went down, but through supplementation of glutamine at 0.5% and 1% helped bring those serum levels back to normal.
Okay. So what kind of impact would that have on things like mortality and bird weight and performance?
So for this, we didn't see a performance effect, but we are also doing more of an immunological study. So with higher replications, we might be able to see the performance. We think that if we reduce the intestinal permeability, we will see less severity of the disease, because during necrotic enteritis, the permeability is lost, and there's a lot of plasma leakage and nutrients that are leaked to the gut, which provide additional substrate for the necrotic enteritis. So we hope that it helps reduce severity of necrotic enteritis.
So from what you've done so far, would you recommend supplementing diets with glutamine, or is it too early to tell at the minute?
Yeah, I'm kind of hesitant on recommendations like that, especially since it's such a new area. I think there's some fields that we need to study farther in, like nutritional studies, to see, is it cost effective? Because right now I had to source it from a company in Asia, and it's a little over $2 a pound, so it's kind of expensive. And so I think there's a lot of areas that need to be worked on before I truly recommend it, but I think there's definitely potential there for it.
So if it turns out to be practical for reducing necrotic enteritis, would broilers need to be tested for it?
I don't believe so. I think it'll be just kind of like another amino acid where we use a set percentage in the diet and feed it either during times where we expect high stress, or just feed it throughout the entire grow out.
So you said that the glutamine's actually expensive. How expensive is it to do the test as well? Is it going to be at all practical?
So in a commercial setting, it more likely not practical, because it's around $400 to $500 to assay it in the serum. But once we start to really do commercial studies with it, we'll be able to tell, is it effective, and then you won't have to test every farm that you give it to. You might just do surveillance testing to see how it's affecting the birds.
So it sounds like you've still got lots of questions to work through to decide if this is a practical way to go. Are you thinking that it could be a really good solution for farmers?
So as far as preventing the disease, I don't think it will. You know, at the end of the day, antibiotics are just about the only thing that are going to prevent necrotic enteritis. It might help alleviate some of the negative effects that necrotic enteritis has, and it might be able to use it in a combination with other products to help reduce the severity of the disease.
Okay, interesting stuff, Jared. Thanks ever so much for talking to us.
Thank you very much.
I'm Caroline Stocks, and I've been talking to Jared Oxford, who's a graduate research assistant at the University of Georgia.